Thank you very much for having me today. My name is David Maman, and I'm the co-founder, CEO, and CTO of binah.ai. A few words about myself. I started very early. I graduated my master's degree in computer science and applied mathematics at the age of 18, and this is the 13th startup that I founded. Binah was founded by me and my two very close friends, Michael Markzone, which was leading deep learning research in PayPal, and Konstantin Gedalin, that besides his PhD in physics, he also holds a PhD in applied mathematics. Today at Binah, we just passed the 60 employees in the company, and we have over 15 PhDs, mostly in physics, that are building the technology that we've created. We have created a software based solution only that allows us to extract vital signs using cameras. The solution itself can run almost on any operating system today, on iPhone, Android, Windows, Linux, almost any operating system, and we're able to extract vital signs in real time. So while I explain how everything actually works, I will be able to connect using just an iPhone, a regular iPhone device, in order to share with you how it's actually working in real time. So this is the screen that I'm sharing, and like every time when it comes to real, something just pops out and we are unable to see. Yes. So I hope that you're able to see my screen that I'm sharing with you now.
Yes, we are seeing your screen.
Excellent. And in this case, this is just an iPhone device that you'll be able to see by yourself. And in this kind of an iPhone device, we are just running the, hi everyone. So in this case, what we're doing, we're just running an application over an iPhone, and you will be able to see that while I speak with you and holding my iPhone, we will be able to extract heart rate within the first 10 seconds. We will be able to extract oxygen saturation within the first 20 seconds. We will be able to extract respiration rate within the first 30 to 35 seconds. And we will also be able to extract stress level and heart rate variability within the first, I guess, about 45 to 50 seconds. The entire technology that you see here in front of you, everything is running on the device itself. It does not require any internet connection or anything like that. And we're able to provide all of those vital signs to be extracted in real time during a session or during a conversation. So everything is available on demand, whether this is an insurance connection or a telemedicine communication that is happening in real time. All of those kind of capabilities that you can see that are now extracting from my face while I speak, all of this information, you can then ship it to the different system that you're interested in order to deliver all of those kind of vital signs for you to manage as part of the medical information or profile assessment or anything out there like that. All of the things that you've seen that we can extract from the face, we can actually also extract from the finger of the person. So for you as a provider, you can rest assured that any conditions will make sure that the information can be extracted in the correct way. So no question about it, the most important part is accuracy. And so far, we finished 4 different trials, and we've been able to validate the accuracy that we're able to extract. We've already been approved for a medical usage in South Africa, in Nepal. By the end of this year, we will get an approval in Japan and in Canada, and we expect that early next year will also be approved as a medical class 2 device in the USA and also in Australia, and CE will take us just a bit further. All of this information, as I mentioned, we are using only cameras and everything running on the device itself, and yet we've been able to prove a class 2 medical device accuracy as part of the offering itself. From a go-to-market point of view, we are delivering an SDK, which means that any company that owns an application or a website that wishes to extract vital signs, they can do it just out of the box. And I will share with you a few customers specifically that already use our technology in real time. Sompo, for example. Sompo is among the largest insurance companies in Japan, already implemented binah's capabilities in order to extract mental stress and wellness capabilities from older customers. Momentum, which is the second largest insurance company in South Africa, is actually measuring vital signs to determine whether you should be able to acquire insurance plan or not. And we can go through a few others type of solutions like Carebook in Canada that have implemented it to do COVID-19 screening, and also Alam in Japan that this is sponsored and supported by the government in order to do COVID-19 screening in a countrywide approach using the vital signs that we're able to extract today. The solution itself, and I think that almost everyone now is talking about COVID-19. And when we go to a restaurant or when we go to a mall, people measure our temperature. But what people found out from all the different papers that were released during the past 6 months is that on an average, only less than 30% of the population have a higher temperature than average, even though they were infected and sometimes also admitted to the hospital with COVID-19. And the technology that we provide today allowed countries and organization to ask people on a daily basis to scan themselves in order to validate if there is any significant degradation or they have been infected with COVID-19, and to take it forward on an almost on a daily basis to conduct that.
Dear David, we are lack of time, unfortunately, and
That was amazing.
sorry.
Thank you very, very much for having me. I wish you all to have a wonderful event and have a great day. Thank you very much.
Thank you so much, dear David. Yes, thank you so much. I wanted to ask for summarizing, but you, you finished before. Thank you so much. Ресурсы медицины ограничены, особенно в данное время. И о том, как максимально использовать ограниченные медицинские ресурсы для лечения и профилактики сердечно-сосудистых заболеваний, разгрузить при этом систему здравоохранения и помочь снизить смертность по данному показателю, нам расскажет Виталий Сирота, основатель и исполнительный
now,
директор
and
компании,
Vitaly Sirota, the CEO and co-founder of a company creating Beecardia medical platform. Vitaly, are you with us?
Виталий, здравствуйте.
Vitaly.
Здравствуйте, Виталий. У нас совершенно немного времени, да. Буду очень благодарна вам за
Good afternoon. We have not so much time. I will be very thankful to you for your very short presentation, and thank you for your invitation to participate in this summit. And I will do the print screen, and we will start.
Да, мы видим ваш экран.
We see your screen.
Приблизительно, да, есть Украина. Да, есть презентация.
And we see your presentation. About 5 minutes, Vitaly, maybe, if possible, not more. Digital medicine and healthcare is important, and its importance grows during the pandemic. Why do we do that? I would like to explain. Cardiovascular disease it is a killer number one. Despite corona, these diseases they kill many more people, and in Ukraine statistics is not so good, and because of corona people are not going to doctors, but it is against our logic. Why do we allow such diseases kill people? Because the people are trained in hospitals, there is equipment, and there are procedures. But why people die because of cardiovascular disease? But the problem is when they need health care, and especially Ukrainians, they are outside of hospitals, and they don't go there, and especially in pandemic situations, they don't go there afraid of catching the disease, and the statistics says it is growing, and at the same time medical resources are limited because of fight against corona. What do we propose to solve this problem? Our Beecardia is very easy diagnostics everywhere with smartphones and application. We can do such diagnostics procedures of a hospital hospital level, and all these results go to a cloud, and artificial intelligence helps us to analyze, and then you can consult a doctor. But why hospitals can save people? Because they have diagnostics, they have treatment, but we can leave treatment in hospitals, but we can diagnosis outside, and we reduce time for launching the treatment, and we save time of specialists, and we provide resources to people who need them really. And it is not our trick, because today lots of doctors do teleconferences, and they can talk to patients. A patient can say he has the temperature, so to make a conference you need to call him and arrange it with other specialists. But in our case, the nurse can record all data for different factors into the cloud, and the doctor can look into this cloud in some 10 minutes, not losing his time, and it can be done more only in very difficult cases. So Beecardia is remote monitoring, is primary medical health care in rural areas. Beecardia during pandemic is remote monitoring, allowing to analyze patients without going to hospitals, and taking out only 10% really need hospital treatment. Also, analysis of normal patients at home, and saving time of doctors. And statistics today shows some remaining symptoms of COVID, and the advantages now of Beecardia. Very standard diagnostics procedures, but very high quality, very easy use, and cloud technologies, artificial intelligence and machine learning, and integration with external gadgets and information systems. And in Ukraine, our solution is certified and produced in Ukraine, and more than 60 teams of ambulances, they started use our solution. You see the map, 60 and they used it in more than 5,000 researchers, and so we look for organizations interested in such optimizations of resources, and why we, because we are a team of Israel and Ukrainian specialists. We have a team in Israel, and in Ukraine we have specialists who know how to use medical equipment. We have the 35 years of experience in medical technologies, and Vitaly will be very thankful for your summary. And I finished. Thank you very much, Vitaly.
Actually, statistics is really not very much promising. Exactly, with the population from 65 plus, we see a very high rate of cardiovascular mortality. For us, it's very important to understand how we could take care about doctors who work with the patients and our parents. Angelica will tell us how we can work with this issue. 1 minute. I would like to get my presentation on the screen, and we will have approximately 5 minutes. I have 5 minutes. I will try to fit, then I will slightly cut my presentation. Do you see my screen? Yes, we see. Could I start? Yes, please. But still, it is in PowerPoint now. It is in a full screen format. Once again, good afternoon. Thank you very much for the participation in this forum. Tyto Care company, what we have developed, it is specific health solution, and it is much different from other solutions in this sphere. In addition to the platform, we have also capacities to have diagnosis, remote diagnosis. Actually, it is a diagnostic tool that combines 4 devices all in one. We have thermometer, camera, and additional accessories that fully cover the line of specific tests that normally take place in eye-to-eye meeting with the doctor and patient. And actually, we could hear what goes on with the heartbeats, we could check what's going on with the ear, we could take temperature. Practically, primary checkup that it normally takes place in the health facility, actually we could do remotely. In addition to this device that is fully with diagnostics capacities, we have also the medical platform which allows the doctor and patient to have a sort of a virtual talk, virtual counseling. And now I would like to show you how actually it works. Here, this device, we are as developers, we contributed lots of efforts for testing, because for us it's also important that it should be very friendly to the patient. Now we have tested the ear, and there are certain algorithms developed and they are channeled remotely, and actually this will allow us to have the best test. The algorithm here actually allows us to see this or that angle in the ear, the level of noise, the level of voice, also very important. And practically we could show to our patient the quality of the test taken with a patient. I would like also to share with you some video, and maybe this will be the end of my story. What actually we use in this or that phase, because everything was started in Israel and then in Europe. When we encountered the COVID threat, we have transferred very many of our procedures. Israel Hospital Tel Ashomer, it is known as Sheba Hospital. It is one of the leading health settings in the world, and initially they used telemedicine approach. Now you may see the patient monitoring who is at home. It is the COVID patient, but some not very problematic symptoms, and practically we monitor such patients from the doctor's office because he has different monitors, and with these devices they could get this or that tests with the patient. The same technology was employed to monitor patients who are admitted to the hospitals. After Sheba, 17 15 more hospitals also very soon, very promptly adopted this approach. And also we have very many such like projects implemented in Europe. I would like to show you some pics of what the projects were implemented. That is home monitoring, where we employ our nurses, and these nurses earlier visited our patients at home, but some of them were in the elderly institutions. But also for us, it's important to monitor patients in the elderly institutions, also who have other diseases, not only COVID, when we are speaking about taking care about these patients. So this is the nurse minimum number of devices, and with this platform we could provide services for very many adults and elderly people. And now I show you some pics. These are some Israeli hospitals. Also, this was the approach that we employed with the severe patients who had severe COVID-19, and all this was done in order to minimize the contacts of medical persons with the patients and to secure medical staff from COVID. I'm sorry to interfere. I would like to thank you. Maybe you will make some summary on your presentation. Actually, we have in Switzerland project, in Italy, in Thailand. This is a sort of a kiosk that was provided to all these hospitals under lockdown. If you have any question, these are email details. Please get to me. Maybe one last sentence. Our equipment is certified in Ukraine. We are ready for cooperation. Thank you very much, Angelica.
And last but not least, I welcome to speak Professor Arik, Chief Medical Officer, BioBeat, who will finish this panel with the answer on how to bring the remote healthcare to its next level. Professor Arik, are you with us?
Hello.
Hello, good morning, Professor.
Good morning.
The floor is yours.
Thank you very much. Thank you for this opportunity. Let me just share my screen. Please acknowledge that you see it.
We can't see your presentations yet. Now, yes. Yes, it works.
Great. Okay, so I will speak shortly about BioBeat. We are an Israeli company that provides remote patient monitoring and huge amounts of data that also allows early warning of patient deterioration. We are all aware of the challenges, especially today during the COVID pandemic, of the close proximity between patients and caregivers, the need to use several different devices to take these measurements. And we have a solution that can help all teams with that. Our technology is based on a sensor which is using reflective photoplethysmography, basically similar to pulse oximetry, but we are using our own proprietary device which provides a much accurate wave, and we're using several light spectrums and our own signal processing and filtration capabilities. And with our algorithms, we've managed to measure 15 different vital signs automatically, continuously, without the need for healthcare providers to take them. You simply attach the device and you get all of these: the saturation, continuous, non-invasive, cuffless blood pressure, heart rate, respiratory rate, and even more advanced parameters like stroke volume, cardiac output, and so on, which is especially important in COVID-19, as we know that it has effects on the heart and the lungs. So everything you see here is gathered automatically. We have all kinds of regulatory approvals so far in Europe, in the US, and other countries. And we are using strict international work and data security standards, as you can see here. I don't have time to go into it, but everything is covered properly. I'll speak mainly about one of the devices. We have a wristwatch monitor, but I will speak mainly on the chest monitor. This is a disposable device. It has two components: the sensor itself that provides all the measurements, and the sticker that helps you to attach it to the patient. The monitor works for up to 6 days, and it is very easy to attach and to detach. It's not alone. If we're talking about hospitals, then it comes with a gateway that provides and makes sure that the transmission is smooth and automatic from the device itself to the gateway through Bluetooth, and from the gateway to the healthcare provider through our cloud using either SIM, Wi-Fi, or Ethernet. Very simple to deploy, nothing to look after. So we're talking about basically an end-to-end solution. You have the sensor itself, you have the connectivity infrastructure, the cloud solution, and at the end, the healthcare providers have a web application in which they can see what is happening now with the patient, and they can see that either on a laptop, a tablet, a PC, whatever they want to use. You get a department dashboard that gives you a general information about how many patients are now being monitored, if someone has any alerts, and so on. You can go into each patient's portfolio, and everything is accessible from anywhere. And of course, you have the monitoring screen itself, which is similar to what you have in emergency units and ICUs. You have all the vitals, just like you can see here in the picture on the right. And if there is an alert, you have a very clear alert appearing on the screen. The management platform allows you also to see the trends of each of the vitals. You can choose which one you want to see. You can see some of them at the same time. And you can also get the historical reports, as you can see here on the right. The screen could be a multi-patient screen, as you can see on the right. And we've also integrated an early warning scoring system, which is based on the news protocol, which is quite acceptable and in wide use all over the world. And again, the nurses don't have to take anything to put the data into this early warning score. Everything is automatic. Every either 5 seconds, 15 minutes, 10 minutes, you can choose the measurement rate.
Dear Professor, we are unfortunately lack of time. Yes, we're running out of time, and I will be grateful for the summary.
So just to summarize, I presented a remote patient monitoring system, a platform that provides an end-to-end solution with high value, especially now during the COVID-19 pandemic. Thank you for this opportunity.